All right, well, welcome everyone. My name is Sarah Ferretto. I am the Director of Alumni Relations at Providence College. I'm also the class of 2003. Tonight is our second in our series this week for Friar Ties. It's an introduction to the School of Nursing and Health Sciences. If you tuned in last night, you heard a great presentation by our inaugural Dean, Kyle McGinnis. And tonight we have a great academic lecture by Dr. Deborah Levine. On Thursday, we're going to have an alumni panel of nurses. And if you registered for any of the sessions this week, you'll receive links to all three of our sessions at the end of the week. So thank you again for joining us. I'd first like to introduce Catherine Hippolyte McManus. She oversees the strategic communications and community relations for the School of Nursing and Health Sciences. Throughout her 15-year career, she has led public relations and communication efforts for the City of Providence, Johnson & Wales University, the Living Rights Center, and various mission-based nonprofit organizations throughout Rhode Island. Catherine is driven by service to the community. I'm very proud to say that she serves on the as the campus representative for the Providence College's National Alumni Association Council and is an active member on several nonprofit boards, including the Public Relations Society of North America and ECHO Rhode Island. Her breadth of experience as a community leader and DEI advocate will support building diverse clinical placement opportunities, partnerships, and collaborations for nursing students and faculty. Welcome, Catherine.
Thank you so much, Sarah. I am blushing over here. Thank you for that kind introduction, and thank you for everything that you do for Providence College. We couldn't do any of this without your efforts and all of your support.
So tonight, and you need to say that you're an alum as well.
That is true, class of 2008, go Friars. So tonight, on behalf of my team from the School of Nursing and Health Sciences, it is just my absolute honor to introduce my colleague and friend, Dr. Deborah Levine. Debbie spent her past 13 years of her distinguished career at PC, and we are so lucky to have her. Currently, she's the chair of the newly established Department of Health Sciences. And if you tuned in last night, you got that exciting news that Dr. Levine is going to serve as the first ever Associate Dean of the School of Nursing and Health Sciences, which is so exciting and so well earned. Congratulations, Debbie. Just a little background about Dr. Levine before she gets started. In 2020, she was awarded the Joseph R. Aquino Faculty Teaching Award, and she teaches introductory courses on U.S. healthcare, as well as upper-level research seminars. She was trained as a historian of science at the Harvard University Department of the History of Science, and her research focuses on the history of medicine and disease in the United States. She is brilliant, and she is kind, and she's oh so wonderful. And I'm so excited to hear her presentation tonight. That's enough from me, although you will hear a little bit from me later when we do a Q&A. So I'm going to pass the floor over to Dr. Debbie Levine. Take it away, Debbie.
Thank you, Catherine. Catherine, that introduction was much too kind. Thank you, Sarah, for all that you did to plan this fantastic event. And thanks so much, everyone, for joining us on this cold and snowy evening, at least here in Rhode Island. I am going to talk with you guys a little bit tonight about hospitals and the American healthcare system. And in doing that, I'm excited to talk about really two separate related stories. One is an American or even really an international story about the rise of the hospital as a central institution in US healthcare systems, in the economy, and in our wider society. And the second is a very local story about the Providence College campus role, the role that our physical space has held over the last 150 years in serving the community, caring for the sick, and helping to control infectious disease. Also tonight, since you have tuned in for a webinar where we can't do a lot of exchange and we can't get to know each other that well, just some bonus points. See if you can spot all of the members of my household, my family members in the slides. They're all hidden in there somewhere. So tonight, I'm going to start tonight with this image of a Playmobil hospital dollhouse. I'm guessing that for all of you to take a look at this, you would immediately recognize it as a hospital. And you might notice the, the doctor in the white coat in the corner, or the hospital beds, the equipment. There are just a lot of signals that would tell us, as modern individuals who spend a lot of time and perhaps we work, et cetera, in hospitals, that this is, that's what this is. And we also live in a world right now where a hospital is something that we might buy as a play set for our kids. And there might be lots of reasons why you might have a hospital play set in your house, right? Maybe you have a child who you know is going to be visiting a relative in the hospital and you want to demystify it. Maybe you hope they'll grow up to be a nurse or a doctor or some other kind of clinician one day. Either way, hospitals are at the center of our society, and they have become sort of just part of living in American communities. This was not always the case. So I'm curious how many of you were born in a hospital, and I'd love to hear stories about this during the Q&A, because in a relatively short period of time, hospitals went from being marginal places in our healthcare system, really places of last resort for the care of the poor and the abandoned only, to being the central places where Americans are born. Almost 99% of us are born in hospitals. Most of that other 1% of us are born on the way to the hospital. And a place where many Americans will end, their lives will end. About 56% of us die in hospitals, and another 19% in nursing homes or related facilities. Not only is this a place of sort of the key moments at the beginning and at the end of people's lives, but also these are key places of employment and economic engines in the United States. So my next question would be, how many of you work or have family members who work in healthcare or in a hospital-related setting? And according to the latest available census data, if you answered yes to those questions, you're in good company, because about 22 million Americans work in the healthcare industry, or about 14% of the entire US workforce. 9.8 million of those 22 are employed as healthcare technicians and practitioners, which includes physicians, surgeons, and registered nurses, as well as many other folks who work in our hospitals. So it's no surprise then that the hospital has become a site for popular dramas. And here are some of my favorites. The old Dr. Kildare and Grey's Anatomy and Scrubs and ER. Maybe you have a favorite medical drama as well. But it's no surprise that TV writers have found this to be such good fodder for decades, because it has really become this center for drama of life and birth and comedy and heroics and tragedy and death. So this is my first family member you'll see tonight. And this is, to point out that many of us are born in hospitals. This is my older son, Ezra, and he was born in the early 21st century, just a few blocks down the road from where I'm sitting at Women and Infants Hospital in Providence, Rhode Island. And we're so used to hospital births that, my guess would be that you're all looking right now and seeing that baby in the isolette, and you're not thinking to yourself, oh no, is that baby okay? What's going on? Why is it in an isolette? What's happening? Because the baby was perfectly healthy, little on the big side, but we are just really, we almost don't even see the hospital technology that's a part of that moment. So it's where we're born. It's where we become parents, many of us. And this is my younger son, Sam, also in the early 21st century, also at Women and Infants Hospital in Providence, Rhode Island. Okay, so those are the easy family members. The final family member of my household you'll see is a little bit of a harder search. So keep your eyes open. Anyway, Tonight, I want to talk a little bit about the hospital's journey to the center of the system. And it's really a 19th and 20th century story about healthcare, about the rise of the US population, and about the problem of how do we care for our sick in a society? Where does that care take place, and who provides that care? So, if you were a patient in the US in the 1800s, you had 4 options for obtaining medical care. By far and away, the most common place to have care was within your home. Chances are you would be cared for by someone in your family or by a nurse who many private duty nurses would be hired to come and help take care of family members in sort of pretty informal ways. And that's where most healthcare took place. But there were other institutions available at that time, or there were institutions available at that time, such as the 3 we're going to talk about tonight: the almshouse, the dispensary, and the voluntary hospital. At this point, in the early 1800s, most Americans would have heard that a hospital existed, but very few would ever have been inside of one. This is an example of the Almshouse Hospital. This is the Northern Home for Friendless Children. This building still exists. It's on the, I always mix up the Jamaica Way and the River Way up in Boston, but it's up there. And these were institutions that were marginal over the course of this period. And they were locations for the care of people for whom society and families and others did not really know how to care for. In fundraising materials for one almshouse hospital, they touted themselves as, quote, locations for the care of the insane, the blind, the crippled, and the destitute. In 1810, Ezra Stiles Eli, a Presbyterian minister, began to preach in New York City's Almshouse Hospital. And when he was asked about his role there by church-going New Yorkers, he told them it was filled with the depraved and miserable of our race, a grand receptacle of blasted, withered, dying people. Even though this young man was spending a lot of his time and energy tending to individuals within this hospital, his congregants and others were really kind of confused, like what was he doing there? Because almshouses were thought to be for the care of people without any family or friends. Patients shared beds, they stayed in large open wards, and Eli wrote that he had to have a strong stomach and a high sense of purpose for the young man to enter this, quote, nest of moral and physical decay. He wrote that the smells emanating from bodies stowed in as thick as they could lie was overpowering. And he talked about the ways that people were really neglected in these institutions. Sometimes patients had to share beds. On one pallet, on one bed, he found 2 abandoned girls, which was sort of a euphemism probably for prostitute or sex worker, that he was assuming that was what was going on, aged 13 and 15. And when he returned, one of the girls was still in the bed, and she, was just really sick and needing a lot of help, but nobody was coming and helping them. So who is in these almshouse institutions? In this period, the idea that one would need to be cared for outside of family would have been considered pretty anathema. This is a pretty rural America with small cities. Patients were ashamed to find themselves in an almshouse because it meant that they had been abandoned by their families, their employers, by their congregations if they were churchgoers, and they most likely were. And in this small society, community membership implied responsibility in families, among members of the same congregation, and between members of the same congregations, between employers and employees. The attendants who worked in almshouses were almost always recruited from recovered patients, and they differed little in background from their charges. So these were highly stigmatized institutions, and the sick were generally blamed for their own conditions. So for example, Ezra Stiles Eli said, quote, "In 9 cases out of 10, premature sickness comes in consequence of making a god of animal appetite." And that is fancy 19th century minister speak for they're not doing the right things, and that's what made them sick. And sometimes I give students that quote and have them sort of like work through, what does it mean to make a god of animal appetite, and to sort of blame sickness for that. So for Ely and others in his community, the people who cluttered the almshouse institutions were considered living proof that God chastised sin immediately and inevitably through the body's own mechanisms, and that this was common. Often the rooms were too crowded for the sexes to be separated, which would have been very much against the standard, the social standard at the time. And this was the kinds of institutions that America had in the early part of the 19th century. This is another example in New York of the Suffolk County Poorhouse, which was another almshouse institution. Another place that people could go for care if they didn't need to stay in an institution, if they had a place where they could live, was the Boston Dispensary or other dispensaries. This was a picture of the Boston Dispensary in 1883. And I tell my students to think about these institutions like medical soup kitchens. This was a place where poor people could go and get outpatient care. They could get medications, they could be examined, they could get sort of rudimentary surgeries and other treatments. And these were institutions that existed to care for the poor, and they existed in many major American cities at the time. Now in 1800, America's population was just about 5 million people, and only 320,000 of those folks lived in a community larger than 2,500. So you can see how community care and home-based care was much more possible in the early part of the 19th century. But the question starts to arise, what about as cities start to get bigger and as urban communities start to grow, people move away from their families in order to seek work elsewhere, what happens to the so-called, and this is the term of the time, the deserving poor, people who could not access care? And that's where we get the institution of the voluntary hospitals. And voluntary hospitals are actually at the root of most of our major hospitals, certainly in Rhode Island and throughout New England, and many of them throughout the United States. The idea here was that as the population and urbanization increased, people sought to create sites for care for the worthy poor who could be cured. They were paid for by voluntary donations, and they were run by a board of lay or religious community leaders in the community. And these institutions had 2 entrance requirements. This was not a show up at the ER and get triaged and that sort of thing. You needed a letter of recommendation for admission. You needed something that showed that you were deserving of charity care and that you had not gotten yourself into these problems. So there was a lot of still blame and stigma associated with illness. And you had to not have an incurable disease. And the idea behind that was that you had to have a disease that people thought you could get help for in the hospital. And the goal of these institutions is to be clean, ordered, and dignified places to care for the worthy and working poor. These are private, community-oriented hospitals where donations paid for the buildings, the employees, the food served, absolutely everything. These are 2 examples of some of our Rhode Island historic voluntary hospitals. This is how Rhode Island Hospital began in 1868, and St. Joseph's Hospital, which was founded in 1892. One of the things that I am so fascinated in when I think about the history of hospitals and hospital design is the way that infection control was built in to the architecture. And so if you look at St. Joe's Hospital, this is a great example of these exterior staircases, which would have been used to carry surgical patients sort of outside and down the stairs so as to avoid walking them past any places where people were really sick and might have been infectious or contagious. So just imagine on a night like tonight, February 28th in Rhode Island, trying to carry a patient down those like metal iron steps on the outside as a means of infection control. But yeah, also just a harrowing thing to even imagine. So these early hospitals started to grow over the course of the 19th century, mostly in American cities, here in the United States, in American cities. And they were, oh, and here's a picture of the Miriam Hospital, which was opened a little bit later. And this photo is from the 1930s, another voluntary hospital designed to care for charity patients, and actually helped to train physicians and nurses and others. So one example of an advantage of these voluntary hospitals is that they were able to expose physicians to their patients in a concentrated way. It was a chance for physicians to observe over time and learn by doing. And it was an opportunity to establish nurse training programs that would train nurses to work in hospitals, institutions, and in other care settings. For many physicians, especially in this period, an association with a hospital would yield a certain amount of prestige. So physicians would work in these voluntary hospitals. Sometimes they would even live there, and that's where we get the term residents and residencies from. And they would then also work with private patients and sort of offset their income that way. As I mentioned, lay trustees are running these hospitals. And by lay trustees, I mean not physicians or specifically hospital administrators. And those folks were in charge of admissions. The patients needed a letter to get admitted, and the letter was not based on medical grounds. It was to decide upon who was worthy and who was unworthy, poor. Rather, it was based on the character and good intentions of the patients. So for example, in a project I worked on just a couple years ago, I was looking at sort of the mission and statements of a number of different hospitals across the United States. And in Philadelphia's Lying In Charity Hospital or Maternity Hospital, in 1834, they promised their donors that they would, quote, discriminate between the deserving and the undeserving. Our object is not to encourage inactivity, but rather to mitigate the unavoidable suffering incident by nature to the feebler portion of the human family. So in this period, with physicians using hospitals to learn surgeries, communities using hospitals to care for their destitute, a couple of things to keep in mind. First of all, the hospital was not an acute institution used to care for long-term diseases. The hospital was not an acute institution. Instead, it was used to care for long-term diseases, and inpatient stays would be very long, months long. And patients would work in the wards, cleaning floors, preparing foods in the kitchen, as part of a long-time arrangement to support their care if they were able. So these were institutions designed to impose order on disorderly American cities and patients. Notice the symmetry, the cleanliness, the focus on light and ventilation in the architecture, and also keep in mind here that patients were actually termed inmates. So people were thinking about these institutions as almost akin to the other kinds of institutions you need in a growing society to kind of keep order: schools, prisons, and hospitals, as well as others. This is a picture I love from Mass General Hospital. This building is still here. Probably some of you have been on the amazing tour of the one of the early operating theaters. If you haven't, you should go. It's fantastic. Mass General Hospital was one of these early voluntary hospitals. It was designed to impose a kind of order on the city. But also, they had to raise animals and they had to keep things together. So even though they had these very orderly, clean insides, there was often livestock and crops and people throwing stuff out the windows, and all kinds of mess on the outsides. And so here's an example of some cows grazing right in front of Mass General. Even though these were better than the almshouse hospitals, care in these hospitals was still highly stigmatized, and there was a lot of fear of what's iatrogenesis, which is a Greek word that basically is sort of medicine causes disease, right? When you get a hospital-borne infection, that's iatrogenesis. This is an example of a riot that occurred on Staten Island in an attack on Quarantine Hospital in 1858, when people from the surrounding community, very upset that there was a quarantine hospital in their neighborhood, really sort of bombarded it and tried to stop the work that they were doing. There were stories of, as much as the stories of clean and clear voluntary hospitals that helped get people back on their feet when they needed help. There were also stories like this one, which is an engraving from Harper's Weekly magazine, depicting a ward in Bellevue Hospital, which had been overrun by rats and other vermin. So this was a really kind of complicated institution, excuse me, and the patients would stay a very long time. If they were able to work, they would help to work to run the place. And oftentimes recovered patients would work as nurses, orderlies, etc., for the rest of their lives in other institutions or in the one where they had been treated. Now, despite all this, Americans come to prefer the hospital, and hospitals start to grow. In 1873, there are only 178 hospitals with fewer than 50,000 beds in the entire United States. By 1909, you get 4,359 hospitals with about 421,000 beds in the United States. Now, some of that has to do with some new technologies and ideas about antisepsis and aseptic surgery, which I'd be happy to talk about in the Q&A. But a lot of it has to do with the way the society was organized and the ways that people who might have moved to work in factories or perhaps had immigrated to the United States and didn't have family to care for them, found themselves sick and needed someone to be caring for them. The biggest chunk of growth you'll ever see in hospitals was between 1909 and 1970. 1970 was about the height of American hospitals, when we had 7,128 hospitals and over 1 million beds. And the last statistics I could find from the American Hospital Association, as of 2022, we had not that many fewer than that, but just a few fewer, 6,901 hospitals. Those 19th century hospitals were built to convey a sense of order and social responsibility. Think of the idea of cleanliness as a sign of godliness. And the voluntary hospitals really wanted to distinguish themselves from the almshouses, which were seen as, such places to be avoided. And so there were these new kinds of architecture that were introduced in order to build these hospitals and to maintain them. And we'll talk about that a little bit more in a second. But our own corner of the world also played an important part in this historical transition of hospitals, from the margins of the care to the center of the care, from the place you don't want to go if you need surgery to the place you really do want to go if you need surgery. And that is here in Providence. If you take a look at this map, this is a 1904 Providence city map. If you take a look at where that yellow arrow is pointing, that is pointing to the site of Providence City Hospital. And you can almost, it's 1904, so it's not there yet. I don't know if you can see my cursor, but Harkins Hall is about to be built right here in just a little bit. So you can see that there are these undeveloped plots of land sort of outside the crush of the main part of the city. And so that is where people in Providence decided to build Providence City Hospital. Providence City Hospital was designed to be an infectious disease hospital, and that's how it started its life. You can see this image, and again, like the Mass General one, people are growing vegetables and corn, and it wouldn't have been unusual to see chickens or pigs or something like that. Also in that big lawn, those of you who are alums probably know what we're looking at. We're looking at Howley Hall. My office is actually right here. That's me. And this is the big lawn that you would see between Howley Hall and the Smith Center. But it started life as Providence City Hospital, which was a charity hospital designed to care for poor people with infectious diseases. And that's how it started life. Providence City Hospital, however, continued to serve the community for decades, and it played a really important role in controlling infectious diseases. And there's a really amazing moment in there are two really amazing moments in the history of medicine that trace their origins to Providence City Hospital and to what is now Providence College's East Campus. Right here, this is a postcard that is advertising a brand of paint that is designed to keep rooms looking clean and pleasant and be sanitary. So there was a type of paint that was developed and used on Providence City Hospital that then was sold and used in institutions all around the world. And this is the back of that postcard, which is just, I think, so great. And many of the superintendents at Providence City Hospital became leaders in public health, not just in New England, but around the world. And so you can see this is a report in the American Journal of Public Health. The founding editor of the American Journal of Public Health was a man named Charles V. Chapin, who we'll meet a little bit more in just a second. And this is an early report about the building of the hospital, as well as the capacity of the hospital and the types of diseases people were seeking care for in that hospital. Now, by the middle of the century, there were a number of terrible polio outbreaks in Rhode Island. And this is, I think, one of the most incredible moments. I had been working at PC for several years before I learned this, and now I'm sort of obsessed with the history here. But one of the first ventilators, a sort of prototype for ventilators, the Emerson iron lung, was used for the first time during a summer polio epidemic in the middle of the 20th century, right in the building where my office is in Howley Hall, right in Providence City Hospital, which by then was named Charles Chapin Hospital. In that case, they were trying out the iron lung, like I said, a forerunner of the ventilator, and it managed to save the life of a young priest who had terrible polio. And that iron lung right now is in the Smithsonian Museum in Washington, D.C. I have a friend who works there, and I got to see it in storage a few years back. And it's really a moment in the history of medicine that we can take a lot of pride in having right here in our backyards. So this is an image from the Providence Journal's image file, the projo of one patient, a man by the name of Earl Nelson, age 19, being moved from an ambulance being into Charles Chapin Hospital in an iron lung. And later, after Jonas Salk developed his successful vaccine to protect against polio, Charles V. Chapin Hospital became the premier site for vaccinating all of the Smith Hill neighborhood, as well as many of the surrounding neighborhoods in Rhode Island. I mentioned Charles V. Chapin. Charles Chapin was a public health leader. He was from Providence, and he was one of the individuals who was credited with helping to spread the ideas of germ theory throughout popular communities within the United States and around the world. So even though Louis Pasteur and other scientists are doing their research on germ theory, the idea that microbes spread disease and that these tiny little animals you can't even see can make these big humans sick, even though those scientists were working on that in the 1870s and the 1880s, it actually really took a long time for people to kind of get a hold of the idea and really change their understanding of how disease could be spread to adopt to germ theory, microbial theory. And one of the main figures in this is Charles Chapin. And I love this quote from one of his books. He writes, and the book is called How to Avoid Infection, and he's detailing a car ride from New Haven to Providence. On a car ride from New Haven to Providence, two small children sat in adjacent seats, one in front of the other. They were strangers, but soon they became acquainted. During the journey, a ticket, an apple, a cookie, a cup, a book, a pencil, and candy were observed to pass from mouth to mouth. If one child was a diphtheria carrier, the other probably caught the disease. And personally, having driven with two small children from New Haven to Providence many times, that is a very apt, that stands the test of time, that explanation. And he was famous for using these kinds of relatable explanations to try to, he called it spreading the gospel of germs, to try to explain the way that germ theory works and that diseases are spread. He also was responsible for building the first Providence water treatment facilities to provide clean water and setting up sanitation in Rhode Island. So trash removal, installing modern plumbing. And he went around the world and convinced other cities to do the same. So it's no surprise then that City Hospital was renamed Charles V. Chapin Hospital in 1931. And now, of course, as I mentioned, it came to Providence College's Howley Hall. Providence College itself is no stranger in protecting the health and well-being of the community, both students as well as folks in the wider community. This is an image from PC students waiting in line for tuberculosis tests in fall orientation of 1951. I loved during COVID when I was teaching and we were in masks and we were all getting tested regularly. I loved to show this image because we all had this idea that we were kind of doing this unprecedented thing at the time, but yet here we are with these right there in gray and black and white, these images of trailers to do TB testing and also x-rays, chest x-rays on all students entering Providence College in the 1950s. This is Father Dorr, who was the dean at the time, the dean of studies, wrote an article for the Cowl in 1953 explaining why everyone needed to go and get their chest x-rays in order to make sure that we didn't have a tuberculosis outbreak on campus or in the surrounding community. So that's just a couple of little vignettes about how hospitals came to the center of our healthcare system, some institutions that I think are really important and interesting to study, like almshouses and voluntary hospitals, and some moments of our own Providence College hospitals. I have just a couple minutes left, and I want to pose the question of what it is that hospital design can tell us about the healthcare system that we're living in. And to do that, I want to explain this photo of the Leahy Clinic in Burlington, Mass. When this complex, maybe some of you have been there, when this complex was built about 15 years ago, it was absolutely state of the art. And these were the marketing images that the hospital put out of the to sort of really promote private patient rooms and also their nurses station. Some of these things look familiar from the old hospital photos. I have some interiors to show you in a few seconds, with the central nurses station, a lot of cleanliness, a lot of light, a lot of symmetry. But you also get this idea of kind of like this cozy room and, a couch and places to rest. And, this idea that you might be having guests, so people need to come in and sit with you. It's a really powerful image of what hospital care could be, or an idealized version of hospital care in this moment. And you may have guessed it, this is my final family photo that I've snuck in. My husband is an architect and he worked on this building. So over here, he's posing as a concerned family member with his boss at the time, who was posing as a physician or a nurse. And then here he is as patient, also with his boss at the time. And these are in the marketing photos that the architecture firm put out. So this was my husband's one day as a model, and I will show these photos as much as I possibly can. We don't call patients inmates anymore. To the contrary, my students in health policy and management are sometimes counseled to call hospital patients, or the folks that are staying there, consumers, or even guests. And some of the new language of managing hospitals really kind of mirrors some of the hospitality and hotel language of other institutions. So before we start our Q&A, I will just ask you to tell me what you think. Are these images hospitals? Are they malls? Are they hotels? Because oftentimes these are designed by the same individuals. They're meant to serve somewhat similar functions, and we can talk about that in just a second. So this first one, of course, is a hospital because it says Mary Hitchcock Memorial Hospital on it. This next one is a mall. It's the Chestnut Hill Mall up in the Boston area. What do you think this one is? This one's a hospital. This one's another hospital. But, we have these kinds of transitions where we have gone from the 19th century idea of how do we control the inmates in the hospitals? How do we make sure that they have these long stays, to moving to a place where some of the more luxurious hospitals, especially those trying to attract international patients or boutique medicine, are calling them guests, and sort of mirroring the hospital, mirroring the language of hotels and other hospitality. It's a really fascinating thing to talk about. It makes for some great discussions in classrooms, and I'm looking forward to hearing your thoughts tonight. I'm also really interested in how we can make sense in this whole context, this broad sweep of the history of hospitals, how we can make sense of the COVID field hospitals that ran for over a year. Here, this is the image of one here in Rhode Island. It was a Citizens Bank call center that had to be transitioned very quickly into a COVID-19 hospital when hospitals were overrun during the early months of the COVID pandemic. And if you take a look at the facility, these images were for the Boston Globe, and they were taken at a moment where Rhode Island was actually really at the center of the global pandemic in fall of 2020, I think. And it was a $6 million renovation, which turned the office building into a modern hospital for less sick COVID patients, folks who couldn't be on their own, but didn't need to be in the ICU, with negative pressure air ducts to sort of snaking along the ceilings, and trying to control and draw out those contagions. So I just presented everyone with quite a bit of stuff. I tried to give you little interesting vignettes from across the history of hospitals in the US healthcare system. Thank you so much for your time and attention, and I'd be happy to answer questions or talk more.
Dr. Levine, that was awesome. I learned so much. Thank you for that. I especially loved hearing the little connections between Providence College. That was extra special. So thank you so much for that. A few questions actually already came through the Q&A, so we can get started with those. And I encourage others, if you have questions, please put those in and we'll make sure we'll get to them. Are you up for answering some questions?
Absolutely, my pleasure. Thank you everyone for listening.
Of course. So the first one I love, the first question that we got is, why do you think it's important for students to learn about the history of hospitals?
Yeah, absolutely. So I think it's important for students interested in many aspects of the working in the healthcare system, but also those of us who might become patients one day, which is all of us, or might find ourselves being advocates for a family member, to understand kind of the history and meaning of these institutions. The reasons and the ways that they were built absolutely continue to suffuse, in some cases for good and in some cases in problematic ways, the values of the society at the time. And though there have been many changes, I really think that an understanding of the history of the hospital can really help us understand our healthcare system in this moment, can be a really useful way in.
Totally agree. Thank you for sharing that. Oh, we just got a new one pop in. Bear with me as I read it. The question says, it's fascinating to see how hospital designs convey values of the times that they are built in. In what other ways, aside from hospital design, do you feel the profit-driven model of healthcare in the US is impacting health quality for the US patients at this time? And what do you see as a future outlook? That's such a great question. Thank you.
Yeah, that's an incredible question. I think we have a lot of, I think, we could have a great conversation about this. We could teach a couple of seminars about it, for sure. I think that, the model of healthcare in the United States that we are running with today, especially, we've been talking so much about clinicians and workers within the hospitals really experiencing burnout, moral injury, and kind of moral fatigue from the onslaught of the COVID pandemic, but also all of the other things that were being faced in hospitals even before long before the pandemic. So I think I think the architecture, like I mentioned, is kind of a good way in. You can kind of see like, oh, what are they trying to convey that they're doing in society? And how can we understand this and also be focused on caring for the sick, which is such a fantastic, area to look into. What comes next in the future? I'm not sure. I mean, it seems like everyone's talking about telemedicine and sort of virtual health settings. So, I would kind of keep an eye to that.
And Dr. Levine, do you mind if I ask a follow-up question to that?
Not at all.
Yeah, so you gave a couple nods to the COVID-19 pandemic, and I was just curious if, in terms of outlooks for the future, if you had any thoughts on how the COVID-19 pandemic either changed or accelerated some of these trends.
That is such a good question. And I think we're still sorting out the answer. I think that there were people who were concerned about hospital workloads, about, certainly about things like nursing shortages and nurse faculty shortages, all kinds of things before the COVID pandemic. I think maybe if you weren't working in healthcare prior to COVID, you could kind of pretend like it wasn't a problem and kind of hope you wouldn't have to be faced with it. I really think that, people working within healthcare, it's, conservatively, it's like 1/7 to 1/6 of the economy is healthcare writ large. That's not just hospitals, but even if you're not a patient or a clinician or having a patient in the hospital right now, you have these interactions with the healthcare system.
Thank you for that. Your conversation's really stirring a lot of questions in the comments, which is just exciting because some are coming in. I wanted to sort of turn to another one that I thought was interesting because it particularly points to Providence College. So the questions about sort of academic institutions, particularly PC, and kind of what role we can play in impacting the American healthcare system.
Yeah, absolutely. That's such a great question. And it leads us into the work that my incredible colleagues have been doing and that Father Sicard has been leading us all, leading the charge for in terms of building a new school of nursing and health sciences here at Providence College. We know that here in Rhode Island and around the region, training folks to work in as clinicians, as nurses, as members of any of the other 30 allied health professions, within the healthcare system is so important. And here at Providence College, we're going to be training sort of holistic healers, people who are interested in caring for the whole patient, people who are not stigmatizing patients and, throwing them in almshouses like in the early 19th century. And also folks who are really thinking through and have been trained to think through and live a real ethics of service and care. So I think Providence College stands in an excellent position to help and really shape the healthcare system. And I think the School of Nursing and Health Sciences is the best way to do that.
Well said, and I think so too, Dr. Levine. A couple more questions coming in. So this one is, in the establishment of hospitals in the United States, the Congregation of Catholic Sisters were leaders in caring for the sick. And the question is, did your research confirm this history?
Oh, yes, absolutely. And I would consider that as part of the history of voluntary hospitals. I have a whole other lecture I could do on the history of Catholic healthcare and Catholic institutions throughout the United States. I think that question comes from our colleague, Brother Ignatius, who has worked in many of those institutions as a nurse and has been a real leader in healthcare. But also, of course, we know that places like the Mayo Clinic were begun by Catholic sisters in Minnesota in the 19th century. Other places around the country that we see, still delivering care today. 1 in 6 hospital beds in the United States is in a Catholic hospital today. And so absolutely, like this history of charity care, it goes back not just within the United States to Catholic sisters, but across Europe, across Central and South America. It's really a kind of a key part of this whole story.
Thank you, Dr. Levine. Another great comment and question. So one, they said your presentation was fantastic, which I totally agree. And they also mentioned that it would be very cool to see some of the history of PC either displayed or charted out or honored in the new building, which I think that's a good idea that we should keep a note of. But now to the question. The question is, do you think there are stigmatized healthcare places / institutions that are sort of stigmatized in the way early hospitals were?
Oh, yes, absolutely. And I think depending on the population, that answer might vary just a bit, right? But certainly, what we have seen in terms of shortages and access to care in the areas of mental health care, psychiatric care. I also think there's a lot of stigma associated with long-term care in the United States, care that's needed by aging people, and certainly care for people living with disabilities. And yeah, the list really goes on. So just because, Women and Infants or Rhode Island Hospital or the Miriam, which is in that direction, but just because those places are places that we are proud to have in our neighborhoods, doesn't mean that there aren't, plenty of institutions and also plenty of individuals who feel stigmatized seeking help in those institutions as well.
Dr. Levine, there's one question that you kind of hit on before, but it's always, since we have one question last, you might have some final thoughts that you want to share. Again, just talking about and being curious about emerging trends that we're going to see in healthcare and hospitals. If you had any other things you wanted to share, this would be the time.
I wish I knew, right? So I'm a historian. I'm most comfortable opining about things when they happened 100 years ago, and nobody's around anymore who can argue with me. But I think, I think that healthcare remains interesting, vibrant, so important, as the US population changes, as it ages, as it moves across different spaces. There's really nothing more fascinating to study in my mind than sort of how we answer the question of how do we care for our sick in our society. And so I'll be watching really carefully and leaving it to my students who become like trend forecasters in healthcare to let me know what comes next.
I love it. Well, Dr. Levine, this was so good. The quality of questions was certainly mirrored in the quality of content of your presentation. So thank you so, so much. We're wrapping up. So I just wanted to say a couple words. I wanted to thank you for your time, your talent, your expertise. It was exactly what we were hoping it would be and more. And I just want to thank everyone here for just being here tonight, whether you're an alum, a prospective student, faculty, staff member. I know you could have spent your time a lot of places. So thank you for spending time with us tonight. Our whole team from the School of Nursing and Health Sciences is just so tremendously excited about an opportunity to share what we're working on and the future and highlight some of our talented team. And it's just been great spending time with you. The fun continues. So if you are interested in learning a little bit more about the School of Nursing Health Sciences and hearing from some of our amazing Providence College alum who, as alum, found the field of nursing before the School of Nursing and Health Sciences was here. They're going to be doing a fantastic panel on Thursday. It's going to be moderated by our dean, Kyle McGinnis. So if you missed him yesterday, this will be another opportunity to hear from him. It will be another opportunity to hear from our fantastic alum in the PC community, and another opportunity to learn about PC and the School of Nursing and Health Sciences and why it's just such a great fit for our institution and why that liberal arts background makes incredible nurses. I am so happy you're here. On behalf of our team, PC in general, thank you for being here. Dr. Levine, if you had any last words, this would be the time to share them. If not, we'll just say goodnight.
I will just say thank you so much for coming. Thank you to Institutional Advancement and to you, Catherine, for all of your hard work on this. And thanks to everyone for coming, and have a good night.
Thank you all. We hope to see you Thursday. Have a wonderful evening, and thank you for joining us tonight. Good night.